Gallegos is going to discuss pelvic fracture urethral disruption.
All right, terrific. Okay, thanks for the warm introduction, and thanks to Drs. Kara and Dr. Coburn for putting together another wonderful program and inviting us at the University of New Mexico to be a part of it. I know it's always an honor and really a joy to be able to talk to you all in front of here in my hometown. Well, anyway, so we're going to be talking about the pelvic fracture urethral injury, and this is the dreaded case that we call the hardest easy case that you'll ever do. And for today's talk, we're going to kind of define the problem. We're going to work it up to as best we can, and then actually go into how we go about fixing these kinds of defects. So let's talk about the pelvic fracture, or PFUI. We used to call it the PFUD, or pelvic fracture urethral disruption, but as we've learned more about the anatomy, it's not really a shear force that kind of causes this problem. It's really an avulsion of the urethra from some of its more proximal structures. And conceptually, this really isn't that difficult to understand. You get a pelvic fracture, and it just kind of pulls the urethra off of its more proximal structures. Pretty simple. But we've sort of found that actually fixing these things can be quite challenging, and we're going to get into that. So in terms of the mechanism of the injury here, it's usually due to a massive deceleration injury, but it can be from penetrating trauma as well. This is usually from bullets, but if we're in kind of the developing world, it can also be from explosive like landmines and things like that. Here in the US, however, it's usually from a massive deceleration injury, ends up breaking the pelvis, and like I said before, you're kind of just pulling the urethra off the more proximal structures. Now, when we look at how often this really happens, pelvic fractures themselves are quite